Hello, everyone, and welcome to the June meeting for the Rural HPV Vaccination Learning Community on behalf of the American Cancer Society and the National HPV Vaccination Roundtable. I'd like to welcome you all to today's meeting, and thank you for taking time out of your busy schedules to join us today, whether that's live or via recording in the future. So today's meeting will kick off our summer series, the ABCs of Quality Improvement, and today we'll be focused on building robust quality improvement teams, aim statements, and action plans. And just to introduce myself, I'm Ashley Locke. I'm an HPV Program Manager for Geographic Disparities here at the American Cancer Society. I have the honor of talking with you guys first, but I'm a part of a much larger team that encompasses many colleagues from both the American Cancer Society and the National HPV Vaccination Roundtable who work on increasing HPV vaccinations every day. You go to the next slide. So let's go ahead and get started with a quick icebreaker. So feel free to share your name, your organization, and which staff members you have or plan to include in your HPV vaccination quality improvement team. I'll give you a minute to do that. Looks like we're starting to get people to write in the chat. Feel free to share any staff members you plan to include in your HPV vaccination team as well. Perfect. Well, let's go ahead and go to the next slide. So to get us started, I do want to share a few general housekeeping items with you. So like I shared before, today's call will be recorded and the video and slides will be shared afterwards via email as well as posted on our website. Because the session is being recorded, if you don't wish to have your image recorded, please stay off video. There are visual directions on the screen. We are asking all participants to make sure that they rename themselves and include their first and last name for attendance purposes. There are two options to rename yourself, and we provide directions on the screen as well. Because we have a very extremely full agenda and want to have plenty of time for sharing, we're asking you to rely heavily on the chat box for questions throughout the call. And as you have questions or comments, please add them to the chat and we will answer them throughout today's session. During the Q&A, we invite you to raise your hand and come off mute to ask questions to our speakers and our panelists. And in order to come off mute, use the microphone button at the bottom left of your screen to turn your mic on and off. And lastly, if you have any Zoom questions or technology issues, we do have the chat box open and we're all here to support you. So feel free to ping myself, Christina Turpin, or Kayla Montelice if you need assistance, and we're available and ready to help you. If you want to go to the next slide. So as far as a roadmap for today's call, we started with our icebreaker. In a few minutes, I'm going to introduce and you'll hear from Josh Kellums about the ABCs of aim statements, building QI teams and action plans, followed by a panel of partners who are going to talk about their experience around these different topics. And then as we wrap up, Tina will showcase our website and some resources we've put together for you. If you want to go to the next slide. Both American Cancer Society and the National HPV Vaccination Roundtable take a systematic approach to our quality improvement framework. This slide in particular showcases the steps we, as well as our partners, use to not only improve HPV vaccination rates, but also cancer screenings. And today we'll begin by covering quite a few topics in our QI framework, which you can see here. Next slide. So before I introduce Josh, I do want to throw out a quick poll to see how many of you are familiar with putting together aim statements, sharing your tips and tricks with us, as well as any programs you use to build out aim statements and action plans. So I'll give you a few minutes to answer that. So far we have 40% of our participants who've participated. Looks like more than half are slightly familiar with aim statements and action plans. The other are a little bit more familiar. But I appreciate you guys answering. We're up to 55%. I'll give it a couple of more seconds. Hopefully we can get a few more. So close to 60%. All right, we can go ahead and end the poll, and feel free to share out the results as well. All right. We're going to go to the next slide. So without further ado, I'm excited to introduce our first presenter for today's session. So Josh Kellums is the Specialty Services Director for HealthLink, a federally qualified health center serving communities across 5 counties in northern Indiana. Prior to joining HealthLink, Josh served in many roles during his nearly 10 years with the American Cancer Society, where he worked alongside FQHCs to improve cancer screening outcomes. Josh lives outside of South Bend, Indiana, with his wife and two teenage sons. So, Josh, take it away.
Thank you. So a little bit about me, aside from what Ashley just read. I was watching the chat, so that's why I'm a little delayed in starting. I see a couple names that I know from my past lives, which is really cool. So prior to starting with HealthLink recently, about 2 years ago, I was with ACS for around 10 years in many different roles. And when I joined ACS, it was at a really interesting time when we were just starting to partner with hospitals and health centers around quality improvement initiatives. I feel like before that work started, a lot of what we did with ACS and those organizations was transactional at most, where we provided resources and brochures and things like that. So I joined at a really exciting time with ACS, and the 10 years I was there, I was lucky and fortunate enough to work with federally qualified health centers the entire time on quality initiatives like this. Much of that work started with HPV and colorectal cancer at around the same time. So those were the two cancer improvement sites I was most familiar with throughout my work. And I just want to share, for full disclosure, that at HealthLink, although I still work tangentially with cancer, I've been working on grant projects and done some consulting with our teams around cancer projects that we're doing. It's not my primary role. My primary role is with our specialists and specialty services at HealthLink. And I work closely with QI and with process improvement, but that's not my day-to-day role. So just wanted to share for full disclosure. So next slide. So at HealthLink, we're a federally qualified health center with 12 clinics across northern Indiana. Our service area covers urban, suburban, and rural areas in that area. And we served approximately 44,000 patients in 2023. We do have a 10-person QI team. Their primary focus is watching quality improvement measures, all the UDS, meaningful use, HEDIS measures, customer satisfaction surveys, that kind of thing. And we have a process improvement director who works closely with the different clinics and the leadership around any type of improvement that needs to happen. That could be quality improvement, or it could be just process improvement around different processes that we have. All of those positions report directly to the chief operating officer. Next slide. So today, what I'd like to focus on are the objectives here. So I'm going to be covering mostly the the model for improvement from the Institute of Healthcare Improvement. We're going to talk about forming a team, whether it's a QI team or a PI team, whatever you want to call it at your location. And then we're going to talk about problem statements, and then go into aim statements a little bit after that. So next slide. So the reason I focused mostly on the model for improvement, the Institutes for Healthcare Improvement were really one of the main foundations for, I don't know that this was the fact, but I think, with my work with ACS, I think this group and this model had a lot to do with the model we put in place to work with health centers and partners. So that's why I really focused on this as my foundation for this talk. I'm going to link to everything, so you're going to see a link here. So it's not like I made any of this up. I do want to make sure that folks can tap into these resources, use these resources. All of this is free to use at the IHI website. You can download toolkits. It's all really great stuff, and that's why I took a lot of it from that. Next slide. All right, so the model for improvement really has two parts that it focuses on. First, it challenges teams to answer the three fundamental questions. So what are we trying to accomplish? How we know that a change is an improvement? And what change can we make that will result in improvement? And then it uses a series of testing those the information that you come up with to answer those questions. So the main focus on the model for improvement is PDSA cycles, Plan, Do, Study, Act. And I believe that's a topic for a future talk in this series. So I won't be going into the PDSA cycles. Instead, I'm going to stick to those first two of the 7 process steps. So within this model, it challenges teams to work through these 7 process steps, to form a team, to set aims and goals, establish your measures, and to use those measures to inform your aims and your goals. Select the changes that you'd like to test, then test those changes, implement the changes, and then spread the changes. A lot of times the implementation happens at a pilot or at on a small scale. So then what does that spreading of the change look like? Next slide. So the first thing I want to talk about is forming a team. Team members are vital to the process. And I think even now, since COVID, I remember doing this work in COVID, and even before the pandemic, it was difficult to get a group of busy individuals together to work through a complex problem. In this case, improving HPV vaccination rates, but anything cancer related, it was difficult because there are so many priorities, so many measures, quality measures that especially health centers, hospitals, health departments are all really focused on improving. And at any given time, leadership might say, well, we want to go a different direction. We want to focus on this. There might be incentives tied to focusing on one thing over another. So getting one solid team together to tackle a project with a single focus can be very difficult, but it's vital to get a good solid team together, or else it's a group of individuals tackling problems without that collaborative effort. So that's why forming a team is the first step, one of the most important steps, and everything else that you do is built off of that. So who do you need on your team? You need a project leader or a leader sponsor. So this could be somebody who is a link between a leadership link, somebody who can break down barriers, work with executive leadership, who can provide resources, whether it's funding or staff time, who can give the okay for certain people to work on a project, who can quickly connect with other departments, and they can hold teammates accountable. So that's why this leadership is really, really important. It serves so many functions. It's not vital for this project leader or sponsor to be at every single meeting, because we know how busy that leadership position can be, especially if you're talking about your smaller organization and it is your COO, CFO, somebody like that who is that executive sponsor. We know they're pulled into tons of day-to-day meetings. But this could be and should be somebody who can review the progress of the team, offer guidance, sort of redirect, and hold, like I said before, hold others accountable. Then you need a process owner. This is someone who works on the process day to day, or oversees those who works on the process. This could be somebody from, like in our case at HealthLink, this would be right up the alley of our process improvement director, somebody who knows enough about the majority of the processes in the system to come in and know how to lead a group around process improvement or quality improvement. For smaller organizations, it might be somebody else. But somebody who knows the systems, or who, if they don't know the systems, they can quickly immerse themselves and learn the systems. Then I think a technical expert is somebody that's important. This is someone who knows how to retrieve the data, the technical aspects of the systems, somebody who might work day to day in the EHR, or in the improvement systems. Or population health systems also would be important. Then you need a clinical and subject matter expert. So this is someone who might have the most historical data or information about the system or the process that you're trying to change. How's it being done currently? They're the ones that might be able to give you the most information around the gaps, the barriers to the process, and tell you exactly how the workflow works. And again, these members might not be vital for every single meeting, but when you do things like process map for your current state and possibly your future state, they're going to be vital to that process. You're going to need their expertise when you're mapping out what's done currently and where you want to go from there. But again, they might be providing clinical care or something like that, where they can't be in a meeting every single time. And then you might want to consider customers. Who's most likely to benefit from the improvement? Oftentimes this is somebody internal to the system, who's the internal customer to the system, who's going to thank you for doing this work. It could be external to the system, but those individuals can be hard to find, and it could be hard choosing the right people to involve in terms of that. But I think internal customers are really important. Somebody who is going to get the most benefit from adjusting the system that you're working on. And then there are additional relevant members, and we'll talk about in a second. So next slide. So this is, for all of these examples, I wanted to put together just some ideas around HPV projects. Again, like I said, I haven't worked on HPV projects in a couple of years, but I was immersed in the process, and these are people I would have encouraged our group to pull in when we were working on these projects. And you might have people that you think would be vital to pull into these projects, and I'd love to hear about that. But for the sponsor, I thought about people like the director of nursing, medical director. Here at HealthLink, we have site medical directors. So each individual location has its own medical director. Those people, if you're going to pilot, would be great to pull in. It could be somebody like your chief medical officer could sponsor the project as well, or your chief operating officer. Who would be the process owner that we talked about? For me, I loved working with people who already worked in QI and process improvement. So if there are leads for that, they would be great, because they know what system that it takes to make a change, to be effective within the organization. So you want to make sure that you're following the process that they know works within the organization. So they would be great owners of the process. In some cases, it might be an RA or an MA or a clinician who works directly in that process, who's for HPV vaccination, who's giving shots every single day, or who's directing the support staff on when they give shots and who they give shots to. That might be your lead or your owner of the process. Somebody who's going to be a great note taker, somebody who's going to be able to update leadership, and know, sort of be able to follow the process from start to finish. So your tech experts, I look at those people like health information technology folks, somebody who knows your EHR backwards and forwards. That might be the informatics team, your population health software, who knows that really well. When we're talking about HPV projects, who is really connected with the state immunization registry? Maybe that's a person who's important to have on board for your team. For subject matter experts, I think of, for HPV projects, people like pediatricians, or pediatric RNs or MAs, somebody who is passionate about improving HPV vaccination rates, who wants to lead the charge, who wants to handle the provider and clinical training pieces of this process, because we know that's really, really important. So those might be your SMEs or your subject matter experts. Who could be a customer? I think of patients. You know, if you're an FQHC, you have to have patients who are also board members. Maybe they're looking for some way to get involved. That might be a great way to involve your board. Parents, there are parents, believe it or not, who are passionate about, positively passionate about vaccines. We know there are parents who are negatively passionate about vaccines, but there are those who are positively passionate as well. Health department colleagues, other colleagues, there are immunization coalitions in different areas. Maybe they're passionate. State health departments, those folks who maybe are holders of some data for you, could be also impacted by this. And then whenever we talk about a cancer-related project, I like to talk about survivors. Is there a way to really bring home the message around why we're doing this, what's really important about this, and how does it impact the community at large? And then other members. So I think of front office team. Here we have patient service representatives who are doing a lot of the scheduling, return appointments, calling and checking eligibility, talking to patients. They're the first face they see when they come in. We have medical education, possibly. The people at the organization that handle the training, education, whether it's clinical or staff training. Community outreach could be vital to this process. I've worked on HPV projects that involved vaccinating dental patients. So maybe you want to get your dental team involved. They really see a lot of the downstream effects of HPV, so they might be interested in this. And then, here at HealthLink, we're really lucky to have a residency program. So maybe residents who are still learning the trade would want to be involved in learning more about how you do process improvement at your site. Next slide. So I was tasked with talking about aim statements, forming a team, but a lot of what we do here at HealthLink is, and I've learned this since I left ACS, because we would, with ACS, do a very abbreviated version of what somebody with, strong, maybe a Six Sigma or lean black belt would do, where they would take a whole day and work with teams. Well, at ACS, we didn't have that kind of time, so we had to work with teams maybe an hour or 2 hours at a time. So we tried to fit in what we could in those times. So we would come right in, look at data, quickly form some aim statements, talk to as many people as we could. But I think learning lately that problem statements are are another great way to kind of take a step back. Instead of going right into what we're trying to accomplish, trying to answer some other questions, like what's not working, when do the problems occur, where do the problems occur, what's the frequency of the problem, what's the impact of the problem on customers, employees, or business. This might involve doing some interviews, researching best practices, analyzing community trends. What's not only the data here in our health system, but what's the data look like in our community, in our county, in our state? How do we compare? What do other health systems do that they do really well or they don't do as well as us? All of that information helps to inform the overall picture or the problem, as it were, for this project. So I think taking a step back, really understanding problem statements, and maybe even starting with, as your first task, your first action item, developing a strong problem statement based on everything that you know. Next slide. So I've, again, just based on HPV related work, come up with a fake problem statement. Hopefully I'm answering a lot of the questions that a problem statement would normally answer. So this one reads, HPV vaccination rates among our younger adolescent population, ages 9 to 12, in our 2 rural clinics have steadily dropped between 2020 and 2024. The rural clinics did not participate in the 2019 HPV Vax QI initiative, and staff, including some providers, have turned over in those locations. If this trend continues, the HPV vaccination rates will fall below state and national averages, which will increase the incidence of HPV-related cancers in our community. So that's a long statement, and I think it says a lot, even though there's a couple sentences there. It talks about what, it answers the question, what, who, where, when, why, and then it talks a little bit about the impact. So the what there are the low vaccination rates, and the who are the adolescents, specifically given a specific age range there, 9 to 12. Where in the 2 rural clinics, maybe in this case, those clinics, the vaccination rates are lower than the urban clinics or the suburban clinics, where that tends to be the problem or the case. When over the last 4 years, so maybe this is a COVID related issue, as some of you might have experienced coming out of the pandemic. Why? Well, there are some potential reasons why this has happened. There's a lack of focus maybe from these 2 clinics. They didn't go through the same education and QI initiative. There's some staff turnover, so maybe they weren't aware of some of the staff policies around HPV vaccinations. And then what's the impact? Well, we know what the impact, the downstream impact of this is. So this is not only good to sort of frame everything that you do from here, it also helps give you some idea of maybe where you want to work on this process through PDSA cycles, do some of your cause analysis through this, or gap analysis. So it can give you some ideas on where to start once you get to that point. Next slide. So now we want to talk about aim statements and sort of how to answer that first question. What are you trying to accomplish, or what are we trying to accomplish? And according to the IHI, the aim statement is the guide to answering the first question of the model, like I said. All right, next slide. So what constitutes a strong aim statement? Well, rather than talking a lot about SMART goals, I think everyone at this point knows what SMART goals are. The IE there. So if you don't, I don't want to presume, I guess. So SMART is specific, measurable, attainable, realistic, and then timely or time bound. And then the IE is something that's recently been added to looking at SMART goals around being inclusive and being equitable when you make your goals. So those are the first things to keep in mind when you're creating your aim statements. You also want to talk about what is the problem or the opportunity, how much will you improve? So Thinking of numerically here, by when would you like to see the improvement? For whom is the benefit, or will it benefit? And where are the boundaries of the process? So next slide. All right, so here are some AIM statement tips, again, from the same group, the IHI group. Again, co-design the AIM. So if you're a champion, if you're really passionate about this work, it can be really easy. And these tips, I think, go along with some common traps when you're starting your project. Or some common pitfalls or barriers. So you want to make sure that you co-design the AIM. It can be easy as a champion or as an expert to want to come in and just have the AIM in your head and then tell the group what the AIM is. But really, that's not what the process should be. It should be sharing all the information and then deciding as a group what the AIM is and where to go from there. Consider your equity gaps. Maybe you want to close a gap between for HPV vaccinations among males or females, or different age groups, or different ethnicities or racial groups, or different socioeconomic backgrounds or insurance statuses. So there might be gaps that within the gaps that you have that are specific to different equity gaps. So you can consider that. You should include numerical goals when possible. So this is pretty self-explanatory, just making sure that you use numbers that make sense, use numbers that go off of your baseline numbers, and then from there, set stretch goals. I think sometimes it's easy to fall into that, well, we want to improve by 10%, or we want to improve by 5%. Those are nice round numbers, but how did you get there? Is that a stretch? Is that going to challenge you and your team? You know, what has your organization set as goals for this priority? If you're doing red, yellow, green benchmarks for your goals, what would take you from a red to a yellow and from a yellow to a green, and that some combination of that to get you there. And be prepared to refocus your aim. Sometimes it's easy with all of the conflicting priorities to sort of forget why you're there, or back off of your original goal, to drop from 15% to back down to 10% because you didn't think you're going to make it. Or you don't want to show leadership that you might miss your aim, so you just back off. But you can refocus those things by making a new aim statement, or adjusting your time frame in your aim statement. Maybe instead of 6 months, you need 9 months or 12 months. So those things are okay to do, but just sort of adjusting because that's what you think is going to hit a goal is not probably the right way to go about it. And then same with be careful from drifting away, or focusing on something totally different. You can get sidetracked by, sometimes providers say, well, no, parents are really the barrier. We want to do more parent education. Perhaps parents are the barrier, but is that something that you can really control in your clinic, is how a parent views the HPV vaccine? So maybe you want to focus on what it is you can control and not get distracted by things like external forces, things like that. Next slide. All right. So for this next bit, I've put together some example aim statements. And again, I'd love some feedback on these. I created these in a vacuum. I've been out of writing aim statements for a little bit. So if you see something here that doesn't make sense, or if you have more that you'd like to add to these, I'd love to see adjusted aim statements. Get out your red pens and tell me how you'd make these better, I think would be great too. But for the first one here, we aim to increase HPV vaccination series initiation among all patients between the ages of 9 and 12, from 37 to 50% by the end of the year. So I tried to make this smart. The specific population, or the specific goal, is around series initiation. The same statement's a little bit more broad than some of the others that I wrote here. but it's a good way. A lot of the projects I worked on started with an aim statement, much like this. Um, Maybe you've noticed that the series initiation is worse among this group of patients. A lot of times you see completion rates or catch-up rates that are much higher than initiation rates. So this might be a good way to focus instead of just, you know, creating an arbitrary 10% goal. This is a 13% increase. So that includes some stretch room there. So for the second one, we aim to increase HPV series completion among male patients between the ages of 9 to 12 from 23 to 39%, which would create parity among female patients of the same age in our Porter County clinics by June, so 1 year. So this one provides a larger numeric goal, but it's for a purpose. It's to get rates up to the same between males and females in your particular clinics. So that's a bit of the difference there. Next slide. So for the third one, we aim to document HPV vaccination administration or refusal to vaccinate in 75% of adolescent patient charts using the appropriate EHR vaccination template at our pilot clinic by October 1. So there's a lot going on here. I've worked with projects where health systems weren't sure of the validity of their data. Maybe they didn't feel confident in their numbers. So this might be a way to quickly, in the span of 3 or 4 months, just look at charts to see if providers are documenting appropriately, or provider teams are documenting appropriately. Or maybe you're developing a whole new system. You've implemented a template in your EHR system where you want to document HPV vaccinations. So this could be a good aim statement to really focus in on that documentation piece. And then the last one there is we aim to increase HPV vaccination among Hispanic or Latino patients in St. Joseph County between the ages of 9 and 13 by 11% within the next measurement year. I kind of looked at this one as a maybe what a health department might write around countywide increases, and looking at that in terms of a specific population who might fall below other populations. So keeping that equity and inclusion piece in mind when we write those goals. And then, if you're looking at changing county level rates over a certain amount of time, you might be a little behind because that data comes out a little later. So maybe you take a larger sample or a larger time frame to look at those rates. So those were just some ideas of aim statements. Again, I haven't been doing this for a couple of years, but it is fun to go through this exercise of sitting down and thinking about how to write SMART goals and how you might base different activities, actions off of the aim statements that you write. So it is a good exercise for the team. Next slide. So as you move forward, I just wanted to make sure that you had resources based on everything that I used to sort of put this together. So the Institute for Healthcare Improvement, which I've referenced a bunch of times here, creates a quality improvement essentials toolkit. You can download that toolkit. I think you have to put in some of your information, like who you are, your organization, maybe an email address, but I think that's worth it to get this great information. So you can get the aim statement worksheet. I've linked to it right there. I think they just linked to it in the chat. You can use a lot of this stuff that's done for you from the IHI to really jumpstart your program, to lead your program, or use it as supplemental tools for your project. So maybe you have a good vision of where it is you want to go, and you just need the tools to get there. So there's also some gap analysis tools, some cause and effect tools, and some more Like I said, this AIM statement worksheet is on there. I think so. There are PDSA guides as part of this toolkit as well. So a lot of what you're going to go over in this learning collaborative, I think, can be found right here. And as you action plan, like I said, it's going to be totally different. You might work an hour at a time with the group when you can pull them together, or you might be able to set aside a full day and work through a lot of these things. You might be able to write a project charter or do your A3s or your DMAIC process, or, there's a lot of ways to go about this. I kind of like this nice, simple way to tackle these process improvements. So I think that's it for me. Next slide, maybe. Yep, there it is. So I don't know if it generated any questions or.
Yeah, thanks, Josh. And with time, and since you're staying on for the panel, we're going to go ahead and introduce the panel and have everyone else come back on. And if you have questions for Josh, feel free to throw them in the chat because he will be on for the panel. So we wanted to introduce our wonderful panel of speakers, and it's going to be moderated by Corey Pitt, Oncology Program Manager at Renown Health. And our panelists today are Liliana Cueva, Oncology Community Healthcare Specialist at Renown Health, Josh Kellum, Specialty Services Director at HealthLink, and Shelley Walker, Associate Director for State Partnerships at the American Cancer Society. So I will turn it over to Corey. Thanks.
Hello, everyone. Hello, panelists. So I would first like to ask everyone in the panel today one question to start. So if you could share your experience building on an AIM statement and a QI team, maybe Josh can take the lead in answering that first.
Sure. I mean, I feel like I used a lot of my experience to talk about what it is I talked about. I think this AIM statement, maybe the one thing I didn't talk about was utilizing the AIM statement for everything that you do, sort of making it front and center as you move forward with your project. I don't know if that's answering your question, but it is one thing that I forgot to mention in my talk was to really, highlight that AIM statement on all of your agendas, come back to it as your guiding post for what it is you're doing.
Perfect. And then, so again, share your experience building on AIM statement and QI team. Liliana, would you like to input?
Yeah, I think going off of what Josh said in his presentation, the very first step that we did before we did the AIM statement was get all our QI teams in a room and just bouncing off ideas like what's attainable, what do we want to strive for. And our leader at Renown Health, Susan Cox, is big on aiming high. So we did set a high goal for our team.
Thanks, Liliana. Shelley?
Hi, yeah, just a little bit of background for the project I'm highlighting today. It was a collaboration between the American Cancer Society and the University of Iowa Prevention and Control Research Network at the College of Public Health. This was a CDC grant-funded project, and my role was to recruit small clinics from rural Iowa, and I do mean very small. That was our target audience that typically don't have an opportunity for this type of work. So it was really fun and exciting to work with these individuals because they really treasured this opportunity with all of us. Through the partnership, we were really using the QI framework for everything that we did. While I was kind of leading the learning collaborative for them, I did what Josh did just with us. I had a formalish presentation on how all of this looks. And then really provided a lot of the IHI tools that Josh did for them in creating so that they would have a template to make it easier for that AIM statement. And then since it was a learning collaborative, we all sat down together, and this was during COVID, but we all were on a call talking about what that looked like and learned a lot, I think, from each other as well. Thanks, Corey.
Awesome, thank you. Here's another question for all the panelists. How did you make your AIM statement / problem statement align with your organizational goals?
Corey, maybe I'll just start. Again, I'm not in the organization, but I was helping to kind of lead that for them. And again, kind of similar to what Josh said, we would just keep reviewing that. But I think the big thing is make sure that you have buy-in from leadership, because you can set a goal, but you want to make sure everybody is bought into that and really be sharing. Also, because it was during COVID, we're talking small rural clinics. I really went from the emphasis of let's be realistic about the percentage of the goal that you're setting.
I think for our QI team, we were kind of unique in that we had the Institute for Cancer there first, and we partnered with our pediatrics team who were actually administering the vaccine. So when we were working on our statements, we often went back to this is cancer prevention, this is a partnership, and we want to really see an increase in our vaccine completion rate. So kind of going back to collaborating with a different department and having that cancer prevention vision and big motivator was what we often looked back at.
I think there's a lot of things you can do for prioritization. I think, for us, we have 12 clinics, and in each clinic has a different quality priority or several different quality priorities. So maybe you start at the clinics where, what you're trying to change is a priority. And then you can maybe, when you talk about spreading the change, it goes from that site rather than maybe system wide at first or something like that. Also including the QI representation, and building off what Liliana said was maybe you use the impact or the potential impact to drive prioritization at your site too. So maybe the work you do can change how the organization prioritizes the different measures.
Awesome. Another question that could be for anyone to answer. How do you address pain points or roadblocks during the planning process?
I'd be happy to go first. I think for us, this was a pretty new project, and a lot of it was research, a lot of meetings, scheduling with the different teams involved, collaborating with the marketing team. So again, a lot of learning the way that the clinics, do this process because we are removed. So research, meetings, and, really utilizing our American Cancer Society partner to kind of help guide, because they've had so much experience with other different clinics. So we reached out for them for support when we did come into any roadblocks.
I think similar to what Liliana said, just really it is that learning and listening. Because I think we're all learning through this process, and what's unique at one system may not be at another system. And we found that out with EHRs for sure. So there are different nuances at different clinics, health systems, and health plans as well. I want to include them as well. And I think just talking about it, because we had our formal monthly calls in which we had curriculum and then time just for discussion. And I also did individual monthly check-ins with each of the clinics as well.
I think the only thing I would offer is maybe lean on leadership when there are barriers and roadblocks. I think if the group can't come to a consensus, I think that's something that leadership can really get involved in and maybe work through those with the team.
And Corey, just here's an example, and I think this is everybody experiences kind of returning for that second dose is a challenge. But sometimes you need something formal like this to take it to leadership or to take it to your physician group. And that's what I think we learned from the data. You know, I think physicians sometimes think they're maybe doing a little bit better with their vaccination rates. So really putting the spotlight on this, just the education was very helpful.
Absolutely. Okay, pulling a question from the chat. As someone on the health department side who is interested in partnering with FQHCs on HPV immunization initiatives, do you have any guidance for how to approach FQHC leadership with projects and get their buy-in? I think this is maybe more for Josh, possibly Shelley.
Sure. I mean, I think hopefully, you know, you're crossing paths with that FQHC leadership at other points through community engagement. I think presenting the data would be great. Asking for data. I think FQHCs are always willing to tackle a challenge like this and look at their own data. So if you present what it is that you know about maybe your service area, and then ask what they're seeing, I think FQHCs are in a unique position to be able to pull data quickly and be pretty transparent with that. So I think just asking that question, you know, is this a priority to you? Do you have the data? Are you confident in the data? And is it something that you'd like to work on together?
Okay. In building a robust QI team, who is a must to have on your team and why? I know Josh kind of mentioned this in his presentation, but any input from Liliana or Shelley? Oh, you're on mute, Liliana.
Corey, because you are in our QI team, do you want to share anything on that? Or we work together on this project, so I wanted to give her the opportunity to share.
Sure. I think that for the robust QI team, I definitely feel like having that physician champion there was really essential to kind of helping us get our QI project off the ground. So we enlisted a pediatrician, you know, someone who is at the clinic every day administering, you know, vaccines to patients, talking to parents about the vaccine was really important because she was kind of the boots on the ground, you know, expert that can kind of tell us what she's hearing from the patients and from the parents, and you know, helping drive those initiatives forward, getting everyone on her team excited about you know, this opportunity and the potential benefit and impact that it can have on our patients. So.
And Corey, I'm going to say one person, a champion. And it doesn't matter what role they're in, but that they're going to drive the bus to what needs to happen. And that can be a physician, that can be an administrator, a vaccine nurse. So really having that champion and that strong leader, such as yourself.
Looks like there's another question in the chat that maybe we can address before, so I know that we're getting close to time. Still having a huge barrier / cultural barrier when discussing HPV vaccine administration for children less than 15 years old. Parents are expressing being afraid of having their children sexually active at a younger age. Any suggestions to address this barrier / vaccine issue?
What our team has really tried to like ingrain in our staff is that the message should be cancer prevention focused and stay away from that topic of STDs. So cancer prevention is how our staff recommends the vaccine.
I think that to kind of build off of what Liliana was saying, you know, we have a lot of Spanish speaking families that live in our community. And so, you know, we've gotten one of our physicians or pediatrician physicians to go on, you know, our, you know, Spanish speaking media and just kind of talking to them about it, you know, just really getting those people who are in the culture to talk to the same people, I think has been really helpful in moving our HPV initiatives forward.
And jumping off of Corey really quickly, also offering any educational material or posters in Spanish that'll make an impact as well.
And the roundtable has some great resources to address that.
Great, thanks. I think we're gonna wrap up here, but if you guys see any in chat, feel free to respond to those as we're kind of wrapping up this call. So I just want to thank all of you, our panelists, and Corey for moderating this and sharing your insight, best practices, and discussing challenges to aim statements, HPV vaccination QI teams, and action plans. So we're going to talk about some wrap-up steps, resources, and a few things for our next meeting. Next slide. First, I did want to share with everyone, if you are joining these meetings, there's been some mix-up of people joining teams. These meetings will always be in Zoom. So find and click the Zoom link to join these meetings. And I know we've shared this during our monthly calls, but wanted to revisit our external-facing website that is built out for all participants in the rural HPV vaccination learning community. And here you'll be able to access the resources shared during the 10-month journey. And it does include all the recording and slide decks from all of the monthly sessions. On the top of the page under important links, you'll see we have placed important documents like the program overview, registration links, ACS, and National HPV Vaccination Roundtable parent and patient facing resources. And I believe Kayla has added a link to the website in the chat. So please bookmark this and use it anytime. Next slide. We have also put together a resource roundup from each session so far. So you'll see continuing education opportunities, HPV vaccination data resources, QI documents, and even materials around HPV vaccination at age 9. We've included all the resources talked about in the May session, including the resources shared from the Texas Children's, including a sample provider video. And we are regularly updating the document. So if you have a resource you want to add, please send it to myself or Ashley and look for some new resources around aim statements and action plans to be added in a few weeks. Next slide. All right, and I just wanted to share this template that we have available as well. Next slide. And another one to share as another resource that's available to help you along this journey of creating your aim statement. Next slide. Thank you. And here are some more resources for creating action plans and utilizing pre-made QI templates in Microsoft Canva, Miro, and even Zoom. So these are some other resources available to you as well. Next slide. So this action plan template will be uploaded into the resource roundup as well. So you'll be able to use this if you would like to. Next slide. And through these roundup. Great. So the poll is launched, and I'll let you guys go ahead and take that poll. And so those questions are just kind of continuing the conversation. Have you organized an HPV vaccination QI team, created an aim or problem statement, and have you put together your action plan? So just following up on our topic today. And I know we're up against time, past time. So I think we'll go ahead and end that poll now. Maybe you want to go to the next slide. Perfect. Thank you for participating in the poll. And once again, this reviews our schedule for the learning community. We'll be meeting again on July 17th, and we'll hear from Andrea Anderson around process mapping and gap analysis. And again, join the Zoom link for that meeting. Next slide. And we love to end our calls with a call to action. So I encourage you to not only look at the website, and that is again linked in chat, and bookmark that for future use. And as we prepare for our July session, I ask you to finalize your HPV vaccination action plan, start to build out a current state process map so you can see where you're at and where you need to go. Organize a time to do a root cause analysis to identify gaps and opportunities before picking out interventions. And as always, we want to know how you thought today went, what you liked, and what we could do better. So Kayla is going to add a link into the chat. So please click this link and complete it after we close out our Zoom, and let us know anything you want to hear for future sessions. These sessions are created for you. So if there's a best practice or challenge you're having, please let us know. And we want to make the learning community a positive learning experience and keep it relevant for you guys. So please fill out that link. And that wraps up our June call for you guys. Thank you so much for being here, and we will see you guys again in July.